And that was Governor Andy Beshear talking to Mark and me just last week about State Representative Savannah Maddox, the Republican from Dry Ridge, who is with us now. Representative Maddox, thank you for being with us.
Absolutely. It's very nice to be here, Michael. I appreciate you letting me join you. Can you hear me okay?
We can hear you all right. I know you were having some problems. If for some reason you dip out, we'll reconnect. So we're all figuring this out. So I had some problems myself in one of the debates we hosted. No big deal at all. It's been a while since we've been in person together. I got to interview you when you were running back when I was at Classic Country 106.7 in Dry Ridge before moving over to the NPR station, and came in and got to know you there for the first time. And since that period, Representative Maddox, you've made a bit of a name for yourself across the state.
Yeah, well, first of all, I want to thank you for doing this evening, as well as the coverage that you provide in Northern Kentucky. I think it's absolutely essential, and it's filled a gap in coverage on Frankfort issues that we typically wouldn't have in Northern Kentucky. So thank you for that. But as far as the name that I've made for myself, I really view this as something that none of us expected to happen, in so much as I'm just now finishing my first term, and I don't think that any of us anticipated that we would be dealing with the repercussions of a pandemic and state government's response to it. So I've tried to do the very best that I can to provide a voice not only for the district that I represent, but for folks across the Commonwealth. And it was never a function of wanting to be the one to get my name out there as much as just trying to do the best that I can to be a good representative.
Well, Representative, I'm going to get your response to what the governor had to say in just a moment, because I know you've been a pretty staunch critic of some of his executive orders and some other issues related to the response to the pandemic. But just as a continuation, since you're in Northern Kentucky and Grant County is part of the Northern Kentucky Independent Health District, Mark and I were talking and sort of lamenting what feels like a lack of information. We're not saying anybody's not being transparent or hiding anything, right? It's just sort of it's one of the ways that Northern Kentucky works or doesn't work, is that there's no point person, there's no centralized spokesperson or center for information. You were nice enough to compliment our work in media. I think this is a big cause of that, or at least a symptom of that there's not even a centralized media voice. But what do you think of this region in general and its response to the pandemic?
In terms of the healthcare side of the response to the pandemic, I feel like the majority of the information that I have received and the correspondence that has taken place on this topic is with St. Elizabeth, because they provide services for the majority of the Northern Kentucky region, all the way down here to in Grant County as well. And they have been very responsive about that. And but as far as Northern Kentucky and the health department and things of that nature, the majority of correspondence that I have had as a legislator has not been with them as much, although whenever I have had a question related to a constituent, they have always replied in a timely fashion. But again, I don't think that any of us could have been prepared to have to take on something of this scale in terms of a systemic and regional approach. So in one way, it's easy to be critical, but hindsight's kind of 20/20, and if there's something good that can come out of it, I hope that we're more prepared in the future moving forward.
Well, and I don't want to hog all the time, Mark, but I know that you say it's easy to be critical. You've been critical.
Yes.
And we're trying to figure this out, like on the fly, all of us, right? Like,
yes.
What are we supposed to do? What is it that you would do if you were Governor Savannah Maddox and you get word that this pandemic has reached our shores and then the state of Kentucky, and you have to take action? Back in March, what would Governor Maddox have done differently?
I'm so glad that you asked that, because I do want to go back to March, and I want to tell you a story that I haven't told before. Back in March, at the onset of all of this, whenever we were in regular session, the governor brought members of the House and the Senate into the Supreme Court chambers, and he discussed the information that he had at that time, and also kind of relayed to us some of the plans and some of the things that he was considering, and he took questions from us. That was the only time that happened. And I felt giving him the benefit of the doubt, because, you know, in Kentucky, politics unfortunately plays a very prominent role in almost everything that we do in the General Assembly, and of course, as the governor as well, he's dealing with that reality. But he, at that point, I feel like most of us gave him the benefit of the doubt because he was working with us. But since then, during the regular session, he pushed the General Assembly to the side. And he no longer sought our input or the input of our constituents, and all of the decision making was done nearly unilaterally. And at one point, he even implied that we shouldn't be down in Frankfurt during session. And I think that that's really where we got off on the wrong foot, so to speak. And yes, I have been critical of the governor for that reason, because again, I think that if you have a Republican majority in the House and the Senate and you have a Democrat governor, the very best thing that you can do in a time of crisis is to try to come together and work on something like this. But I don't think that that is what we have seen. And then, of course, past March, we began to see the issuance of executive orders that shut down 2/3 of Kentucky's economy. You may be aware of this, but 2.2 million Kentuckians have applied for unemployment since March, which is 54% of the entire workforce. Now, again, with hindsight being 2020, we know the economic repercussions that can result from shutting down the economy. We know the unemployment rate. We know a lot of the ancillary effects that have taken place in response to this public health concern. But we also know that there could have been a more appropriate balance, as opposed to shutting down our churches and not allowing people to engage in activities that are protected by the United States Constitution and the Kentucky Constitution. So, my hope moving forward is that instead of utilizing the executive orders and making mandates, that he will continue to make recommendations, because I do firmly believe that Kentuckians can make good decisions with the information that they are given, and that is the role of the government. Not to use force against the people, but to give them the information that they need to make good decisions.
Representative, so it sounds like to me that where you had your biggest issue with the governor's actions that were taken were based in that it was a lot of executive order, it was mandate. It seems like he's softened that approach to a degree where now he's being a little bit more along the lines of encouragement and not enforcement. That being said, do you feel like the steps that the health community is asking us to do in terms of masking and social distancing, do you feel like personally that is something that your constituents should be doing?
I think that people need to be vigilant and diligent about abiding by the recommendations that are made, in so much as their individual circumstances may dictate. And by that, I mean that, again, role of the government and any permutation of that as far as the health department, so forth, so on, to provide that information. But I do think that we run into an issue where the way that the government has handled this public health concern by shutting everything down, by going into lockdown, which we have seen in other states and frankly in other nations, is not the answer to this. I think that whenever we are able to make that decision for ourselves, you're not going to have the type of effects that we have seen over the course of the past 8 months, because I do believe it's been devastating. One of the things that I noticed whenever we return to our interim joint committee meetings, I sit on transportation, and I was shocked to find that first month, whenever we went back, that there was a 43% reduction in road fund receipts, for instance. And, only in the next legislative session are we going to see the full effects of what the economic shutdown has created, not just unemployment, but with the education side of this as well, what the learning gap that has ensued will be as a result of going away from in-person instruction to virtual instruction, all the services that the schools have provided, the children that frankly may not have enough food as a result of this, because none of us were expecting this to happen. But at the same time, you have to be able to make these decisions in real time. And, my chief critique of the governor and the way that he has handled this is not only a function of the fact that he has, and his constitutional or his executive orders have been struck down by judges at multiple levels for being unconstitutional, but simply the fact that he has not sought the input of the General Assembly, which that's the people's voice. We talk about a balance of power. It's incredibly important to maintain that. And I think that going into 2021, that is going to be a main focus of the General Assembly, is to address the issues in KRS 39A that have led to this situation, to restore that appropriate balance of power, to where citizens are not having to rely on the judiciary to be able to exercise their constitutional rights and to provide for their family, to put food on the table if their business has been shut down.
Representative, what about masks for you? Do you wear a mask?
I wore a mask in committee earlier today, and if the circumstance is appropriate, I typically do wear a mask.
And if a business mandates it, have you gone into any businesses that have mandated it and you've worn a mask?
When the circumstances are appropriate, I choose to wear a mask. I never want to put a business in a situation where they are going to incur any type of penalty from the health department or anything of that nature, because I think that it's very important to give our businesses every opportunity to succeed and to not be an impediment to that. So again,
is that a long way of saying yes? Like if you went in a restaurant and it says mask required to enter until you sit down, would you put a mask on, or would you not go to that business?
I've tried to do everything I can to support our local businesses, because restaurants have been hit especially hard with the reduced capacity and things of that nature. I think they've been among the hardest hit, and I do try to patronize those as much as I can.
So do you patronize them in a mask before you sit down?
I do everything that I can to be a good example, and I often do choose to wear a mask, again, just to make sure that they are not at risk of incurring any type of penalty, and that I'm not an impediment to their ability to thrive and to prosper.
Okay, so you are wearing it out of consideration for the business. What is your personal opinion on the efficacy of facial coverings during this pandemic?
I'm not credentialed in medical science. Therefore, I'm not going to opine on the effectiveness of masks or anything of that nature. What I would say is that I believe that people should have the ability to choose. And I think that Kentuckians can make good decisions about when it's appropriate and when they should wear a mask.
But you are a legislator, and lawmakers do often make laws about subject areas that they might not be experts in or credentialed in. And if you are talking about curbing the governor's power when the session comes back in January, and that is something you've talked about, if something along the lines of whether you can mandate facial coverings, what would be your reasoning to oppose it?
I feel like Kentuckians should be able to choose whether or not to have to wear a mask. And of course, there have been exceptions to that if there are health issues that have arisen that they are not required to do so. But again, if I'm in a situation where I am not able to socially distance 6 feet, then I typically will wear a mask out of consideration for others, but it's not something that I feel should be mandated. It's something that I choose to do under certain circumstances.
Representative Maddox, to move the ball forward a little bit, and I know you sort of alluded to the fact that you're looking forward to 2021. I think you've got some priority bills and maybe some legislation that you would like to see passed. The governor, I don't know if you were on while we played his clip, name checked you to a degree and had invoked you and said that you were going to lay the smackdown. Or I did not hear that, so that's a secondhand conversation between the governor and yourself. But forecast for me your 2021. What do you envision? What are you trying to get done at the legislature this year?
Sure. And again, it's unfortunate how politics has kind of entered into this conversation where it needn't have had to have been prior to that, as far as this talk of SmackDown, so forth, so on. But it truly isn't personal. It's just a function of restoring an appropriate balance of power to the three co-equal branches of government and restoring the consent of the governed. What we will do, and this will be a top priority for the General Assembly, is that we will take KRS 39A and we will provide additional protections in there for our constitutional rights, and so much as free speech, as well as to make sure that businesses are no longer subject to these executive orders for an extended period of time. In all likelihood, what we pass will create a 2-week time frame, because the executive branch should have the ability to intervene quickly or act, or in this instance, to enact a state of emergency, but that should have its limitations. So probably a 2-week time frame is what we're looking at. So in the event that an executive order surpasses a 2-week time frame, the General Assembly will be called back into session in order to be able to address the situation. Because frankly, if we ever were to have something of this scale to take place again, I feel as though we would want the General Assembly to be able to take part in that and to be able to give voice to their district, because that is our job and that is our core function.
Representative, I just want to go back very quickly before we talk more about maybe legislation in the coming session. And I want to talk about response to this pandemic, because we are seeing in our Northern Kentucky Independent Health District, the 4 counties, including the 2, you got a piece of Boone County in your district, don't you?
I do.
Yeah. Okay. So you represent 3 of the 4 counties.
Well, I have Grant County, Southern Kenton, a little bit of Boone, and Northern Scott.
There you go. So you got 4 counties. Scott's a little farther away from our area, but we're seeing a spike here in case positivity. And as of today, Kenton and Campbell counties are in the red zone. Grant County is half a point away from being classified as red. It has been suggested by scientists that wearing face masks, socially distancing, limiting crowd size is the response. A lot of people right now in official positions, health and political, are suggesting that a lot of these cases are spiking from private get-togethers. You're suggesting that this should be left up to personal responsibility. And in a lot of ways right now at this point, it is. And people are acting in a way based on the stats that we're seeing each day that would suggest we're being irresponsible. Do you not agree with that?
I think that being irresponsible is subjective to a certain extent, because I hear what you're saying and I understand that about the case numbers going up. But having recently had a conversation with St. Elizabeth, they indicated that they feel like they are adequately prepared, because the whole concept behind flattening the curve was that we did not want to exhaust medical resources that were available to our community to where folks would have to go without care. I feel like we've adequately accomplished that. And as far as the outcome of the coronavirus and what that will look like, there's so much that I don't think that we can be able to determine if the shutdowns or even the recommendations, if any of that is working. This is all so very new. And yes, it's important to be diligent and to show caution and to take this virus seriously. No one is disputing that. But my issue comes in whenever state government itself tries to mandate what we should or should not do. Recommendations and providing us with the information to make good, solid choices, I absolutely support that. It's only prudent to do so.
But isn't it not the role of government to protect the public as best it can? You know, I mean, we're facing something where some people's actions could impact the health of others because of this spreadable, communicable disease that has killed a lot of people, including more than 1,400 people in this state. How do you philosophically reach that balance of mandates, legislating, in order to protect the public health? I'm sure you support measures that keep people safe from a variety of dangers.
Sure, absolutely. But I don't think that we can find any evidence that state government's response prior to now has done anything to stem the tide in terms of the shutdowns before, because clearly we have not in Kentucky or any other state eradicated the coronavirus. And the shutdowns, if anything, the data suggests are inversely related to that. So again, recommendations are good and fine, and we're all doing the very best that we can, but at the same time, using the force of government to prevent someone from earning a wage, such as, shutting down their business, using the force of government to prevent people from engaging in constitutionally protected activities can never be the answer, because I do not believe that the government has the ability to keep us safe from the virus. The government has the ability to provide we the people with information that could potentially produce better outcomes, but it's up to us to heed it.
Well, I know that we probably have to let you run and all that, but let me just get, Mark, I'm so sorry, but let me get one more thing in here.
You got it, brother.
We should be moving towards herd immunity, or should we be taking more restrictive measures to slow the spread of this virus?
Michael, you're going to have to repeat that if you would, because the last 15 seconds were pixelated and I wasn't able to hear you.
Oh, I'm happy to repeat.
Sorry. Sure.
I got you saying, I know you have to run and we've got to run, and this has been very enjoyable, but I wanted to ask whether you support moving towards herd immunity or taking more measures to slow the spread of this virus.
I think that, again, the very best thing that we can do is to be perceptive to the information that's given to us, to be prudent of the recommendations that are made. But I don't know that the data is there to suggest that there is a right way or a wrong way to deal with a virus of this nature.
We have to make decisions now, right? I mean, we have to make decisions today. We're now in the red zone, and depending on how we're supposed to react to that, we've got to make decisions about how to live. So is it stop eating out? Is it stop having family gatherings, or is it go out, live your life? It's going to get you eventually. Let's get herd immunity. Which one do you think of today?
I can't make that decision for anyone else. As for me and myself, You know, I could easily say this is what I'm going to do, but I think that each individual circumstance is different. Whether or not you have a loved one who is immunocompromised or whether you yourself have health issues, I think that it requires an individualized approach. And that's a decision that each individual Kentuckian is going to have to make in accordance with their own set of beliefs and their constitutional rights.
Representative Savannah Maddox, the Republican from Dry Ridge, thank you for spending some time with us. I hope you'll tell my good friends at Beans Cafe that I miss them, and I look forward to a big Texan donut very soon.
Yes, sir. Thank you so much.
All right. Thank you. See you later.